During the early days of the pandemic, valuable PPE was in short supply. Everyday citizens took to their sewing machines and began making face masks for those in need. And in my eyes, these mask makers are real heroes.
And a follow-up from the presentation before. Could you explain to perhaps Dr. Bricks why wearing those masks is not helpful to healthy people?
Let her speak about the masks, and then I'll give you an update on our progress.
So it is helpful for the healthy person, for the infected person to wear the mask, because it does block their ability for droplets to spew. And we know from information coming from other countries that that is where the virus is, in saliva and nasal secretions. And so if a person that is infected is wearing the mask, that decreases the amount of droplets that are available, the same way as coughing into your elbow. Those masks won't protect you from the droplets because of for you wearing it, because you will pull air in through the sides. That includes the viral particles potentially.
And it's one of the ways that the American people can help us making sure that medical equipment is available broadly is by not buying masks, not taking them off the market.
There has been so much mixed messaging about the coronavirus and mask wearing. Early on, I personally felt like wearing a mask was the right thing to do.
Countries with the lowest fatality rate have a mask culture.
They told us in the beginning that no, you don't need to wear a mask because they were trying to save them from medical personnel. And I understand that medical personnel needed them more. But telling us the fact that no, you'll be fine without a mask to save them from medical personnel was the wrong situation. I think that was what really screwed us. It was detrimental.
Hi, my name is Wei Tam. I am the creator of Community Face Mask of Salem, Oregon. I am also a volunteer regional lead for MaskNow.org for Salem area as well. Community Face Mask of Salem, Oregon is just a public forum I created on Nextdoor and Facebook. It's just to provide information about DIY cloth mask tutorials, COVID-19 related articles, and also most importantly provide awareness of COVID-19 asymptomatic cases. I'm also a mother of a 4-month-old who's going to be 5 months soon.
Hello there! I am Trisha Trixie Hunter Merrill. I know, that's a mouthful. I like to go by Trixie, and I currently reside in Greenwood Village, Colorado.
Hi, my name is Brian Roeder. I'm 43 years old and I live in Santa Barbara, California. I co-operate a karaoke company with my partner normally, but during the pandemic, we've been shuttered for about 2 months now.
I'm Christina.
I'm Tess.
I'm Jacqueline.
I'm Robbie.
I'm Sabrina.
And we're the Sack family. Today is May 24th, 2020, day 64 of our mask making journey.
Zoe Olson. Today is May 11th, and I live in Alabama.
My name is Elizabeth. The date is May 8th, 2020, and I live in Texas. So this is my setup. I am visually impaired, so I need a very giant monitor. I have a 32-inch monitor to be able to go online and be on the computer and look up information and things like that.
I'm Kai Frog. I live in Loveland, Colorado.
What got me started in the mask making activities was just the reaching out from next door, from Good Samaritan Hospital and other places where they were seeking masks for the first line responders at Salem Hospital and also the Good Samaritan Hospital. Currently working on masks for the elderly and those that are more compromised. So mostly the nursing homes is the first wave that we're trying to focus on now. We actually donated a few to the homeless as well in Salem.
I ran the LA Marathon on March 8th with about 27,000 people. My partner and I, we came home and went into quarantine the next day. I actually don't have any formal training sewing. I wasn't in home ec. I grew up in a little town called Spiro, Oklahoma, so a boy wouldn't dare take home ec. But my grandmother, who lives in Missouri, my grandma Roder, she taught me how to sew at 8 years old. She taught me how to make Cabbage Patch clothes for my Cabbage Patch doll.
The face mask movement was a grassroots effort. There were hundreds of groups and thousands sewing for those groups.
I originally made just a few masks for my partner Jerry and I, and then some of my friends asked me to make some, so I made probably about 15 at first, and then I said I wasn't gonna make any more. I didn't like the pattern I was using. There's no way, I'm not gonna do it. I don't have the time for it. And who are we kidding? I was just laying in bed watching Netflix and eating, basically. Like, that's what most people are doing under quarantine, I think.
Always sewn. Since I was about 14 years old, my mother was the one that taught me how to use a sewing machine. She is one of the main reasons why I do make masks. She is a 2-time cancer survivor, and because of chemo, her immune system is very compromised. If she goes out, her chances of getting sick are very high. Her chances of if she gets sick, her chances of having she's going to have a really bad outcome. She's one of those 1 or 3% that people are saying, oh, well, it's only going to affect that percentage of the population. Well, that's my mom. That's who it would affect. So I wanted to make masks because it's such a simple thing to ask people to do to protect everybody else.
I started sewing actually when I was a lot younger. My grandmother, Grandma Hunter, showed me how to sew. But I grew up in California after my father had passed when I was 10, and so I didn't really learn those type of farm skills that my sisters learned while growing up in the country because I grew up in California. Later in life, a friend, Carrie Elliott, showed me how to sew and start doing quilts.
Taught me when I was very young, and I just knew the skill, but I never really started to make stuff on my own, so masks. really.
I've been sewing like in my lifetime for, since I was 14, I think we took a sewing class in home ec. But my mom used to sew when I was little. So I used to do that then, and I used to hand sew when I was really little and make doll dresses. I started sewing for Masks Now just because I have a lot of nursing friends because of my son and because of just cosplay, which being a cosplayer in the con community, you make your own costumes, and I'm also a photographer, so I make costumes for my models for my photography. And I had my nursing friends asking, hey, can anybody make masks? Because we have none. And so I picked up the gauntlet and started making masks for my nursing community friends. And then I heard about the Million Mask Mayday, which was what Masks Now was before they changed names, the Masks Now Coalition.
When the mask process came into play, I didn't really think that I wanted to be a mask maker. I thought there's so many other people doing that, and it unnerves me with a serger that has a blade that chops the fabric. Putting your hand underneath something like that doesn't seem appealing when you're not quite sure of your surroundings and you have what we call chemo brain, which is a slight little dementia. And sitting down at the sewing machine, it really wasn't conducive for me at that time.
Well, due to the fact I have this baby right here, I can't really sew too much mask, so I try to provide resources, mask making materials to other mask makers and also mask making groups.
Yes, we started this about a week after the shutdown order started at the beginning of March. And really we started with the Deaconess Hospital pattern, which is CDC compliant, and called for 2 layers of 100% cotton, elastic over-the-ear bands, as well as a pleating design. And that worked well for about a week, and then after that we started doing more research into what would make the mask more effective, and we got a lot of feedback from friends, people in the community in the medical field as well as the scientific field, who were telling us that filters would be a really nice touch to include in the mask. So we ended up tweaking our design to allow for a panel in the back that could house a removable and replaceable fiberglass-free HEPA filter. So that was a really interesting aspect that we learned through this process.
We have this whole system in place for the Bucket Brigade to make masks. It's pretty clandestine. Like you make your mask and you set them out on your porch, and somebody comes and gets them and drops off your material like a fabric fairy. One of my friends, Diana, she donated $150 to send to my hometown in Spiral, Oklahoma, to the volunteer fire department there. Fabric donations from everyday citizens in our community to our hotels. But we're really thankful for that.
I'm actually one of the head regional people for the Masks Now group in the northern Colorado area, and one of the people that I help direct up here. She just donated another about 60 yards of her personal fabric to the cause to go to the cutters to set into more pre-cut squares that we can set off to other sewists so that they don't have to spend time personally cutting fabric themselves, that I can just hand this off and say, okay, get to work, just sew this.
As of today, we've made about 5,652 masks. That includes adult mask, teen mask, and kids mask. It's been a great project. Everyone in the community has come together. They've delivered us supplies like the cotton, the elastic, and the thread to make this all happen. We couldn't have done this without their support, so we're grateful for that. And we're grateful for having
the ability to actually make these masks and give them away.
So yeah, I love making masks. I don't have a lot of time though because I work full time. But when I do have time, I like to go out to Joann's. I like to purchase the fabric and the materials and give it to the lady, the point person Jean, who gets all of the kits together and hands them out to those who have the time to sew. So my role has mostly been purchasing materials and providing materials. I've sewn maybe only about 35 myself because of time. It's been rewarding.
I went for a walk the other day through the park, and it was like I was at Disneyland or something. It was wonderful just to be out and about. But yeah, the old me, I would have complained and said this is terrible, but there's doctors and nurses out there that they don't get to come home to their families and spend time with them. They're quarantining themselves just to keep their families safe out of fear that they'll infect them. And then there's other people laying in hospital beds dying who will never come home. They're dying alone.
Not really affected. I mean, I work at Walmart, so I work.
I have an 18-year-old special needs kid, adult, who is very high risk and is epileptic, has cerebral palsy, and a whole slew of other medical issues. We are very, very cautious with everything that comes into our house, whether it be food, packages, anything. We spray everything down with alcohol or wipe it down with Clorox wipes. Whether that's over cautious or not, we'd rather be safe than sorry, and that's our choice. If I get sick, or if my partner, who is also my son's CNA, gets sick, my son will get sick. And so, yeah, we're afraid of getting sick, just because if we get sick, he gets sick and he could die.
Yeah, as we move through this global pandemic, that sense of community is definitely something that has upheld us and continued to motivate us throughout. I think at this point we've all been affected in some capacity, whether as simple as the way we shop for groceries, the way we interact with our loved ones, the way we work, and the way we contribute. And we're fortunate that we have this method to continue to make a positive impact. And as we continue to practice safe measures, we're confident in what we've been doing to minimize, potential exposure, potential transmissions, through social distancing, mask wearing, lots and lots and lots of hand washing, and wiping down of things. But there's still that sort of fear, that anything can happen. Any interaction could be a risky one. But we've chosen to not focus on that fear and instead focus on making that positive impact and making a difference with what we can do.
Yeah, we had an unsymptomatic patient that came into my office where I work and to see our nurse practitioner, and later was tested positive for COVID-19. And so I was notified, of course, as we would do, and I notified all the patients that were there 3 hours prior and 3 hours after the patient had left. But it was kind of scary to think that we could have been exposed and potentially have the illness. And so I tried to get tested myself and I couldn't. So I went ahead and purchased the $180 antibody test by my chiropractor because my primary care doctor wouldn't test. She said there wasn't enough funds and it was too expensive.
In the coronavirus pandemic has personally affected me because I am a 2-time cancer survivor and I'm currently only 9 months cancer-free. After my second bout with cancer, we found out that I also have Hashimoto's, which is an autoimmune disorder. While both of those things affect me differently, they also make me immunocompromised. With this coronavirus, the COVID-19, of course I want to be extremely careful in going outside. So I have been one who has strongly sheltered in place. I only go out when I have to get groceries, or just to get outside to take a walk so I don't feel such cabin fever. But I definitely am cautioned and concerned by it. I didn't learn how to sew clothes and how to do other things until I had my fashion business, Trisha Trixie Designs, where I made couture aprons that I called Not Your Grandma's Apron, and I really enjoyed doing that. The cancer, however, made it hard for me to sit down at a sewing machine, and so even though I had come out to Colorado for my fashion business, I had to put it aside because I just couldn't sit down and do it.
I am a conceptual fine art photographer. I take normal pictures and turn them into weird, fantastical art. I am not even doing my artwork now. Most of my art is pretty dark stuff, and being stuck into a home and not having an outlet in my artwork, and then the sadness from the world outside. And so yeah, I needed a creative outlet that wasn't going to bring me down. Even though it still brings a lot of tears, they're often happy tears. One of the most recent ones, I had a little old lady, her and her husband, they don't have internet, they didn't have like a smartphone, and they didn't have masks. They couldn't go to Costco, they couldn't go to the grocery store, and they were terrified. They didn't have any family here, so they had nothing. They had what they had in the house before all this started. And they were just scared. So I called her and I said, hey, I've got these masks for you. I've already called her. She knows you're coming. Take these over and set these on this woman's porch. Please. I called the little old lady back, told her my friend was on the way, and she just cried. She's like, you don't even know. I had nobody to help me.
Back in 2018, I lost a significant portion of my vision due to diabetic retinopathy. So one eye is completely gone. I can't see anything out of it. It's really more of a nuisance than anything else. And for the other eye, I've had to have several surgeries just to even get it stable enough to see what little I can out of it. So sewing is not that easy. I see people, on their YouTube tutorials, and they're like zipping by with rotary cutters, and that just can't be me. I have a really hard time with that perception and gauging where things are. I'm constantly like cutting thread and not really cutting it because my scissors are on the side of it or something like that. I lost my vision. I used to work for the library. I used to go on driving all across town. I had to move out of my apartment because I lived in a second-story apartment and it was no longer safe for me to walk down the stairs at night. I had a lot of trips and really scary moments. And so I ended up leaving the city that I used to live in, and I moved back in with my parents. So, and I've done a few things since then, but mask making is definitely something that I have really enjoyed because it is something that makes me feel very productive and that I am helping somebody.
The sewing group I'm in, the Santa Barbara Bucket Brigade, I believe there's close to 300 mask makers, sewers in it. In 3 weeks and 2 days, that we had a challenge, the April Most Mask Making Challenge. We sewed collectively around 7,000 masks. So me being a marathon runner, I haven't been running during this whole pandemic. And so I have a really like a need to compete. So I use my competitive spirit to win the competition. And I believe I was the only guy in it, and I won. I won a $300 gift certificate to Trader Joe's. Really fantastic prize package and peace prizes throughout the contest. Rusty's Pizza, they give us free pizza. Yeah, our community's really, really resilient, and we're all pulling together to help one another.
The challenges posed by sewing these face masks were many. The pandemic had created shortages not only in toilet paper, but also fabric, elastic, and interfacing.
Issues that we faced were ties or elastic, because not everybody wanted both, and if you probably heard, there was quite the elastic shortage. I had to learn how to be very resourceful. I did like using t-shirt yarn, which there's two types. I have a t-shirt yarn here that you could order online, or the homemade version, which you cut from t-shirts and then stretch.
I stand up the whole time I sew because I don't know how to sew any other way. I normally sew 12 to 14 hours.
From start to finish, it's like 15, 20 minutes. And when you first start out, it takes 30 minutes to make a mask. So then I got to the point where I could make a mask in about 15 minutes, but it took some time to get there. It's tough to find materials. So often I would go on to Amazon and find it, but even then the shipping and the time to get it was very slow. I have found that the elastic material, the cotton elastic fabric, is actually more comfortable on the ears.
I start with a pretty simple process. I use a 3-layer thing. I use 2 pieces of cotton and a piece of interfacing, or this is a shop towel. It is a non-woven piece of material, and I layer them down, and I use bias tape or cotton twill, and I set them in, and I'll clip them into the spot and sew them all the way around and make sure that my cords are out. And then after I'm done with that, I reach through, I'll clip the corners. This one is partway done. Oh, let's see if I can get it to go. And then I turn it inside out. And this one is going to look like a pumpkin because I use what materials I have on hand. And this is partial mask. My next process, or the next part in this process, is to create the pleats and sew up the hole and sew the strip on to here, and it'll be a mask.
The transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary, you don't have to do it. They suggest it for a period of time. The new mask guidelines also do not replace CDC's guidance on social distancing, including staying in your home when possible, standing at least 6 feet apart for a period of time.
The face mask movement was a grassroots effort. There were hundreds of groups and thousands sewing for those groups.
For every yard of fabric that they donated to the cause, I was making them 2 masks. It worked out in my head that I could spare 2 masks and get 6 for donation.
I do not sell my mask. I actually do my mask on a donation basis, partially because I don't feel it's right to sell masks. I think we're in a global pandemic right now. I think that we need to be great humanitarians, and that's what I strive to be, the crusader for humanity.
I've went back and forth on whether I should charge for masks or just strictly donate them to people in need. I've started to reach beyond my community here in Santa Barbara, like my hometown in Spiro, Oklahoma, and Fort Smith, Arkansas. And some people just don't want you to just give them a mask, and they insist on paying you for a mask just because of the time you spent making it for them. I still give masks away, but I'm also charging now, and so I'm doing both. I'm trying to get as many masks on people as I can. I'm not making any money on it because I'm investing the money right back into my sewing supplies and fabric.
I donate all my masks. I've donated every single mask I've made because I just want everybody to have a mask. And if everybody has a mask, if we're insistent on reopening the economy, then maybe if everybody has a mask, my mom can see her grandchildren again.
We have been donating our masks and are dedicated donating them. We want to ensure that everyone has access to obtain a mask for their daily use, and we want to make sure that everyone is taking the same precautions. We believe that this was the best way to ensure ours, our families, and our communities' health and well-being.
I have sewn with my team and myself over 1,500 masks.
60 to 70 masks. It's really hard to tell because I mostly just donated my mask to the general public and also to different organizations. Oh, funny baby.
It's frustrating because it takes me, I see some people I've made 500 masks, I've made 1,000 masks. I have made maybe 100, 120, something like that at most. I feel like that's an incredibly paltry output. But then, I remember that I do have, a few limitations, so I'm a lot slower than everybody else. It does make it a little bit hard to sew. Everyone knows when I'm my sewing days because I have to take so many naps because the strain on my eyes is so much just to even focus them. It's difficult.
I have made and donated probably anywhere from 500 to 1,000. I do a lot of paperwork for other people. I sew and then I do paperwork, and I sew and I do paperwork. And if a friend was an essential worker and they needed masks, I'd sew and just give them to them. I didn't keep track. I'm glad that somebody's using them, and somebody that needs them, somebody that is now being safe.
Sewn over 2,000 masks, that self-sewing group.
Based on what it sounds like, they sold over 2,000. It's because there's a lot of people in the beginning didn't really keep track. Every member kind of wants to donate to whoever they want, so they don't really remember where everything goes. That's the thing about dealing with volunteers.
Right. Yeah, it is hard to coordinate because we are volunteers and we aren't on a schedule, and everybody's schedules vary. But we try to make it happen, and so far it has worked pretty well. So I've been really pleased with the number of masks that have been able to be made during this time. And given the lack of supplies and the difficulty getting materials, it's been amazing how many we were able to put together.
Right now there's anti-mask protesters.
I see the anti-mask protesters as those who really don't have a lot of knowledge or understanding of the virus and the impact it has on their health, for future health as well, because apparently COVID-19, as I've seen on the news from the scientists, that it can cause permanent damage to lungs and other things. And so I think it needs to be taken more seriously.
A couple that I know of give my aunt a hard time over making some masks and tried to tell her that they don't work and the N95 masks are the only things that work. Well, these cloth masks are better than nothing, and if we all wear them, then they're gonna help. They're gonna help slow the spread, and that's what it's about. Slow the spread, save a life.
It's not about whether you believe in it or don't believe in wearing a mask. I know that by me wearing a mask, I'm protecting myself, but I'm also protecting you.
It breaks my heart that there are people out there that refuse to wear a mask, that think this is all, still think that this is a hoax, that it's their right to march on the capitals and march without a mask, and yet they're the ones that are coming down with COVID and infecting all the other people marching with them, and they're infecting everybody else, and they're the ones spreading this, and they're spreading it to their families, and they're sick. I mean, come on. This is ridiculous. We're never gonna get better until everybody plays by the rules. But until the rules mean everyone.
They don't really like wearing them, so they always complain about how they can't breathe and stuff and why this is help. And you get all of those customers too. Customers are great. I mean, they just complain. Well, some customers complain about people that don't wear masks. And then there's some customers that complain about people that wear masks. It's very interesting how people react.
I'm a person that likes to deal in facts. It's not that I don't like opinions, but I like opinions based on facts. And so I encounter quite a few anti-maskers when I'm on Facebook. And if you are going to have an argument with me about masks and the efficacy of wearing masks, you need to get up pretty early in the morning, because I am very prepared. I have bookmarked and read all the articles on masks and their effectiveness, and what are the best materials, and different studies that have been done on masks. Let's say you're wearing a mask, and you wearing a mask and everybody else wearing a mask is only going to prevent 1% of infections. Isn't that enough? Isn't that enough of a reason? For the amount of time that you wear a mask outside to go do your errands, to go get food, to go grocery shopping, and if you're wearing a mask is going to prevent 1% of infections, isn't that enough? Don't we care enough about people to do that for them? To be uncomfortable for just a little while? One thing I don't know how to do is I don't know how to make people care about others. That I can use facts and I can use figures and charts and whatever, but ultimately it's going to depend on the person wanting to care about others.
What do I think about our government? That's a really loaded question, especially now. It's a mess. Our medical community is amazing. I have nothing but love for our medical community, our doctors, nurses, all our healthcare workers. The CDC I think is doing what they can. They have their hands tied behind their back.
Honestly, I don't think the government responded so well. I think the people have responded better. I see a lot of love in our communities. I'm also part of a group that collects information in Colorado and disperses it and just is a hub of where food was in the beginning of things, where supplies were when toilet paper was a short thing. We had a lot of people running food trains. Hey, you need this? Okay, we'll be right there. We will take the risk and we will throw on a mask and we will drive this over to your house and we will drop that off. Hey, you need baby food or diapers for your kid? We will run this across the state and drive it to you and drop it off.
I feel like had the federal government been more responsive and more taking this seriously versus looking at this as kind of a hoax and nothing bigger than a flu bug. I think this level of pandemic could have been slowed down or at least prevented. I think if we had taken it seriously in the beginning, and that's one thing I wish would have happened, but obviously that's in the past, so I'm not going to worry about the past. I'm just going to focus on the future.
And it took the Western government a while to kind of catch up. Here in the US, we're always used to just kind of like being not actually facing anything and at this level. Even in the beginning when the pandemic happened, a lot of people were like saying it's not going to happen to us.
Right, because people like Bill Gates were talking about this back in 2015. And a lot of people that have actually talked about this, even Obama talked about it when he was in office. And so we knew at some point it would hit us, but we just didn't know when. And obviously we weren't prepared as much as we could have been. But now we know, we kind of know, okay, we need to be ready because this could be an ongoing thing. And so I think making masks is going to be an ongoing process because I don't see this going away. And ultimately, if they come up with a vaccine, I think that's going to make people feel very safe. So I think all of us need to do due diligence and keep social distancing for a while.
I ordered more of the firefighter fabric. It's actually going to provide 384 masks to, I'm hoping, 4 or 5 different fire departments. And as soon as I posted the picture of the mask to let her know where her money was going, someone told me that she died yesterday morning. And so I never got to share with her what I did with her money and how many people she's potentially helping. And I'm just devastated.
So I wanted to make masks because it's such a simple thing to ask people to do to protect everybody else. So if we can protect others for something so simple as wearing a mask when we go out, why wouldn't we want to do that?
I always want to help people. I'd give the shirt off my back if it would keep somebody else warm. This isn't going to keep many people warm, but if it helps somebody, I'm going to do it. It makes me feel better to be able to help somebody else. Growing up, I didn't have a whole bunch, but I just want to be able to help people. And I think that's just kind of who I am as a person.
And making these masks so that I may help you, so that I may protect you, that this mask that I wear protects you while you're wearing your mask. Make a difference, be a good human, and leave a legacy of love. Over and out, Trisha Trixie.
Well, as a mother, I mean, this is close to my heart regarding my family, how it's impacted my family. As for me, I'm self-employed, I work from home, so it has not impacted me as others, but I see how it had impacted my children, not being able to go to work, working from home, not being able to go to school, going to school online, going to school at home. So I've seen that, but what we are able to do is that we are able to get together and basically bond, and we started this project of trying to help the community make a difference, and it had made us closer to one another.
Yeah, I agree. I think to echo what my mom is saying, it's been a really interesting and kind of fun experience to be able to live together under the same roof for the first time in a very long time for many of us, as we're grown and we all live separately. So quarantining together, we're trying to find new ways to interact and make this time quality time together. So that and the mask making process has been a good way for us to kind of get back to our roots in terms of what's important to us, and a way for us to gain control over a situation that many of us feel that we don't have control over, in terms of just giving back to the community and feeling like we can make even just a small difference in someone's lives by providing masks.
As if I keep just one person from getting sick, then that's payment enough. That's all I'm trying to do.
I would like to thank all mask makers everywhere for all of your participation, all of your work, all your time, all your effort. You're real heroes. And there's a few other people that want to thank you.
You get a lot of use out of that.
Thank you, South Salem Sewing Group and friends. The masks have been such a blessing here at Samanka Place.
Thank you, mask makers. You guys are heroes.
I just wanted to say thank you to Kai, and I'm just very appreciative of the fact that there are people out there making masks and donating them to people who need them.
Thank you, mask. Thank you, mask makers.
Thank you, mask makers.
Thank you, mask makers.
Maybe